Hey everybody, we are back with another round of Medical Mamas. Today we are speaking with one of my good friends, Dr. Bridget Etter. Hey Bridget. So Bridget and I go way back to college. We went to Xavier University, Louisiana, and the funny thing is that our husbands, unbeknownst to us, before we all kind of reconnected and everything, actually went to middle and high school together in Wichita, Kansas. So great to have them as such good friends. And I delivered 4 months ago. Bridget recently delivered, and so we're going to talk a little bit about her experiences on today. So, Bridget, why don't you start off by telling us a little bit about what life was like, pre-corona?
Before Corona, things were much simpler and easier, less stressful for sure. I would say with my work schedule being the way it is, it allowed me to travel kind of freely. Let's see, I was able to get probably 3 trips in before March of this year, my final trip being my baby moon, which
Oh,
I'm
wow.
happy to say I was able to squeeze that in before travel restrictions were put in. But before that, I mean, just the little things, being able to go out to eat, go to brunch, just stuff that I guess we took for granted at that time.
Like a normal life.
Exactly. But just, just moving freely about town, I think.
Yeah.
Um,
So tell me about your family, home life.
Home life is new and good. Interesting. So with a newborn, so she's a month now. She
Yay.
kind of runs things here. Things kind of centered around her schedule, which is not a schedule, just whatever she makes up at the time. So between all she does is sleep and eat and play, I guess.
Yeah.
That's kind of it.
Yeah. So do you recall kind of when and where you were when the shelter in place came down? What were things like for you then?
When the shelter in place came down, we were actually, I was still working, but we were trying to plan our baby shower. And it was actually a good thing, if you will, I guess, that they officially put in the shelter in place, just in that the CDC had put in the restrictions as far as limiting how many people, should be at a gathering. So trying to work within that space,
Mm-hmm.
so everybody else could feel safe as well. So it was kind of stressful. There was a lot of back and forth trying to even change like venues and things. So when the shelter in place came in, it kind of was like, okay, just forget about it. It was just one thing off our plate.
Right.
Just in that case. So
Sure. Sure. Um, so once the shelter in place was official and you were still working around that time, tell me how that balanced out, work and home, pregnant.
So thankfully, I have a great team. So as you said, I am a hospitalist, meaning I only work in the hospital, seeing hospital patients, all kinds of hospital patients, ideally in any setting. But being like 8 months pregnant, 9 months pregnant at the time, my team was just really responsive and caring, and you know, kind of advocated for a schedule change for me without me I didn't really have to fight for it.
Oh, wow.
Yeah, so they were able to change kind of what floor I worked on versus seeing med surge, i.e. COVID patients,
Hmm.
even going to the step down unit or just the sicker patients where COVID patients were as well. Just kind of avoiding those areas and kind of getting me to the lower acuity from a medical standpoint. Just kind of get me in that area and kind of ride out my days until I go on maternity leave. So
Right.
I was very thankful for that. I know a lot of pregnant healthcare providers are not able to have such accommodations and have a team that's so caring, really,
Right.
for lack of a better word.
Right.
Just to get you out of that situation because there's so many unknowns. So
Yeah.
very thankful about that. But even my day to day, the way I operate, I mean, I really my team also advocated for me to kind of isolate myself from them. Usually we work in our office, kind of all of us in the morning,
Mm-hmm.
um, kind of reviewing the chart for our patients, and we're very collegial, so we enjoy
Mm-hmm.
kind of getting together in the morning, looking up our patients, and then we disperse around, and then afterwards we kind of come back to the office, finish our work, etc. So just kind of avoiding them because in the beginning there was the PPE issue. Should you wear an N95? Should it be a face mask? Should
Right.
it be a bandana? What should you do as far as protecting yourself? And so there's so much, again, uncertainty. They were like, maybe you just shouldn't come in the office. So
Right.
just instead of coming in the office, I was going right to the floor and rounding,
Yeah.
reviewing the charts, rounding. My nurses were amazing. So my floor nurses, they were really good about getting me my mask. Like as soon as my week started, they'd get me a fresh mask in a new bag to put it in. So I kind
Awesome.
of changed completely different how I work. So I just spent less time physically in the hospital.
Yeah.
So I'd round and kind of come home and finish my work. But again, very thankful to even be able to do that. Again, a lot of people just aren't able to do that.
Right. Right. I mean, because I bet it's very anxiety provoking to because all of us as providers, this was such an unknown for us. How easily it would be transmissible. Is it left on inanimate objects for a period of time? How long is that period of time? What inanimate object? Even touching food,
Yeah.
containers, all of that can be very stressful. So, tell me a little bit how you felt during that time period. Sounds like you had a great team and great support, which is amazing. But tell us a little bit, some of your feelings during that time.
Incredibly stressed. I mean, I distinctly remember when my coworker diagnosed our first COVID patient. It was not
Yeah.
the typical travel recently. They just didn't have that travel history. They just our ID team, our infectious disease team, had just come by and done a little talk for us, and so
Hmm.
they kind of told us what kind of things to look out for. And so my colleague just kind of put two and two together and just went out on a limb, and we were all like, it'll probably be negative, blah blah. We came back positive, and we were like,
Wow.
oh no, because it
Wow.
had just taken that travel history out, expanded it to so many other patients who had been in the hospital for a couple of days, had already
Right.
been seen without the right PPE just because it didn't warrant it.
Hmm.
Um, so my team probably sunk my anxiety. I mean, I was just like wound up. I mean,
Right.
sitting in the office made me nervous. Walking through the halls made me nervous. Seeing new patients made me nervous because, were they gonna turn around and spike a fever?
Yeah.
And or was I gonna get a new patient who, met that criteria and then they turn out to be
Right.
positive? Just all that uncertainty just had me so nervous. And then because it was so new, we're learning so much about it. I would
Hmm.
come home and watch CNN, and
I
that
know.
didn't help either, because that would just make me. It's like I would learn more.
Right.
Seeing the numbers tick up and it double just made me so nervous.
Yeah, we eventually implemented a rule in our house, like 10 minutes of news a day, because like you're
Yeah,
saying, like you get so overwhelmed with the new information and the new weird side effects. Definitely something we need to know as physicians. But being a physician doesn't necessarily help much when you're a new mom sometimes, and just trying to experience and live and learn. I think that even for me caused sometimes a little bit more anxiety than education. So yeah, we we had a little bit of a limit for a period. So um, so tell me some of the things that you incorporated in your home life that may have been a positive or something that came out of this shelter in place experience. Well,
positive
first,
out
wait,
of
we totally
it.
skipped over something.
Honestly,
Tell me about. Let's talk about the birthing experience. Sorry, like now we're gonna fast forward to.
oh yeah,
I jumped over that whole aspect. Tell us about the birthing
yeah.
experience during COVID and isolation.
Um, that was probably one of the things. I mean, being a first-time mom and it being uncharted territory, there was
Right.
already a lot of nerves going into it. Uh, one of the things that I guess was on, I guess the forefront of my mind was, would my husband be able to be there?
Right.
All you hear about is the worst case scenario out of like New York and stuff where there's no visitors at all. So when our hospital system implemented no visitor policy, I was like, oh no, you know.
Right.
Um, but thankfully in labor delivery, they allowed one support person. So for me,
Sure.
of course, that was my husband. That was all I needed,
Right.
just to be there. So that was something that was worrisome for me. So when we got to labor and delivery, I think I guess the worst part about the whole thing was the COVID test itself. Um, I went in thinking it was like a flu swab, but it was not. Not like it was much.
Yeah, it
You had
gets
to look
kind
at it.
of far back, right?
Yes.
Mm.
And they said it's a tickle. It's not a tickle. It's a scrub. It's painful. It's painful.
Wow.
So
Wow. Well, it's awesome that, you guys were able to share the experience together because I know it can be, frightening, firsthand, frightening to have your first child, and, to even fathom not being able to have support there. I couldn't even imagine. So glad you guys were able to be together during that time. So fast forward to now, she's here. You guys are home. She's beautiful. What's home life like? I think so. For me, when I delivered in mid-February, shelter in place wasn't there. It was a little bit of a radar kind of the virus kind of overseas, but not so much here yet. Maybe there were some people in California, but basically about 3 weeks in or 3 weeks postpartum, we were on lockdown. And so I know I personally experienced a lot of anxieties and isolation, not being able to have folks come around and help you in the traditional manner, not being able to take those little breaks, whether it be leaving the baby at home with your husband and going to the grocery store just to, take yourself outside of the environment. So I definitely know that part. So tell me a little bit about your experience.
you know, it it's actually interesting being on quarantine before being on maternity leave because
Right.
we would joke because we would go out and hang out and travel so much. We would think about how hard it would be to be on our own lockdown, be on maternity leave. So it kind of took that part out of it to the point where we were like, wow, let's hurry up and have this baby.
Right.
It was something to do.
Yeah.
But yeah, like you said, I mean, not being able to have family, I mean, stop by the hospital, um, come and meet her, just stop by. It's very, very foreign. I mean, having my family here, that was something, of course, that's just what we do. And when, we have new babies, and
Hmm.
so not being able to do that. And then even like to be able to for her to meet my parents, is crazy. And it's like it kind of gives you a sense of paranoia a bit,
Right.
because it's not just that person, it's who that person has been around.
Hmm.
Um, so it's almost like, when will things be good enough or make you feel comfortable enough to be around those folks?
Right.
There's that. Like you said, being able to just step away. I mean, I like going to the grocery store, but
Yeah.
the paranoia is like, sometimes it's not worth it. It has to be like a big trip,
Yeah.
or kind of working around there, or even just going to the mall, or even
Right.
be able to go and, work out, like go and get breakfast with a girlfriend. You know what I mean? Those kind of little
Hmm.
bitty things that you should be able to coordinate around, the schedule, but you just can't. So it's
Right.
like you said, isolating is like the perfect word. Because then it's just me and the hubby and the baby,
Right.
which is fine, but that's stressful in and of itself too. So just allowing, us to get an
Yeah.
outlet. So
Because you have all these plans, it's like, whoa, I got 12 weeks off. So, you're making plans to go home. You're making plans for, people to come visit, just taking little trips, just,
yeah.
I mean, going to the park. I mean, I remember towards the end, I was Googling, activities, around the city for, moms and their infants, like, infant
Oh
yoga and stuff
yeah.
like that. So it's like, oh, all of that, came off the
Out the
list.
window.
So out the um, so and now that you are experiencing it, anything that you've learned about yourself or your family during this time of isolation?
You know, I don't know. Honestly, I'm a little bit of a homebody anyway. So this is just kind of an extreme version of.
Sure.
If anything, I kind of value just having that just my family in general, because we kind of all found a little way to check in with each other. You
Hmm.
know, things like Zoom and Duo and FaceTime.
Yeah.
Just hopping in on my parents. Sometimes I would just video chat them just to make sure they're home.
Right.
Like, where are
Oh
you?
gosh.
So, just we find little ways to still keep in touch. So
Yeah.
just find the
What's
little things.
what's maybe one of the most creative things that you've experienced during this time, or anybody's done, during this time for you or the baby or anything? Now, I definitely enjoyed your virtual baby shower. That was a lot of fun.
Yeah, I would say that would probably be it.
Yeah.
That was not being able to have a baby shower was just so, it was sad. It really made me sad. I know there are worse things that people experience in this,
Yeah.
time, but when you're pregnant, there are just certain things that come with it. And I know when I first got pregnant, I was like, I'm doing everything that
Right.
I can do, I wanted to do. And baby shower
Yeah.
was definitely it. I wanted to have one with my girlfriends. I wanted to have one with my family. Just I'm
Yeah.
blessed to have a wonderful support system. So just knowing that I've got aunts, uncles,
Right.
cousins, that want to get in there, I just love
Yeah.
and just see those faces, and get together, because we always have a good time when we get together. So not being able to do that, I had people that booked flights to come out here to be with us,
Yeah.
and for them not to be able to come was just crazy, and not being able to tell them when, so
Right.
being able to do it virtually was so much better. I didn't know what to expect, but it was great. It was just
Yeah.
great being able to see everybody's face. I thought it would be sheer chaos, but it wasn't.
Yeah.
But it was great. It was
Yeah,
great. So
it was fun because, I think sometimes because, I traveled back home for my baby shower in December, and my mom invited people out of the woodwork. I mean, one of my ministers from my old churches when I was in high school that I hadn't seen in a long time. I even had like one of the techs that worked in the OR with me who would come. And I mean, people that I hadn't seen in years and years, even since like middle school. And it was very hard, I'll tell you, to catch up with them and spend that time with them, share with them, talk with them, when you have just so many people pulling you in different directions. So that was one thing I admired about your baby shower with, so many people being there. Number one, you could truly be the focus of attention. And, there wasn't so much diversion and time, like you were able to chill, but it was still able to communicate with everybody, and everybody had their chance to communicate something with you. And I think even me as a new parent learned some things from the more senior parents that were on there, that maybe we wouldn't have had the opportunity to do or share like that if we had an in-person one. So definitely was a great event. So we're going to switch gears here a little bit. Just something that is laying heavy on all of our hearts. Racism is a public health issue. We're physicians, so we see a lot of the disparities in medicine, but now being new moms and seeing what people of color are going through, with the recent deaths of Ahmaud Arbery and Breonna Taylor and George Floyd, tell me, how has that affected you, in your daily life?
so I guess the biggest thing is just every time my husband leaves the house, just thinking about my family members, as you can see, it could be anybody. I mean,
Hmm.
people say, oh, they shouldn't have committed crimes. That is not, that's not the problem. I mean, it's just being alive and being Black,
Yeah.
and there's nothing you can do about it. Some of these things just are not avoidable, anything that you can do.
Right.
So just every time someone leaves the house, just knowing, that they're traveling to and from work, or, just what could happen. Will they be the next one?
Yeah.
Being on maternity leave just decreases how much time my husband leaves the house. So I'm
Yeah.
kind of glad about it. But still, I mean, when he does leave, it's like, oh God, what's,
Yeah.
just wanted to come back home,
Yeah.
and so.
Yeah, especially during certain times, you're like, your curfew is from dusk till dawn. So, so, so if the light's on outside, you're good as long as the sun is shining. You can go.
Mhm.
But no, I mean,
Yeah.
I definitely get that sentiment. Um, so you have a beautiful young daughter. Have you guys discussed any of the conversations you anticipate having in the future, or has anything that's gone on
Mhm.
changed how you anticipate you will raise her?
You know, I don't I don't think it's changed anything yet.
Yeah.
I think just in general, there are some conversations that we as African Americans just know you just have to have with your children when they come up. Having an African American girl, just knowing that she's going to be different, from a lot of people in her class. Knowing that she's beautiful, just accepting who you are, those kinds of things. And then, of course, there's the race issue.
Hmm.
You know, thankfully we're a month in, so we have a little time, but you just kind of know
Right.
that it's coming. But just in the last couple years, really knowing that now you have to add that element of your interaction with police.
Yeah.
Whether she's an all-star student, A+ student, good girl, like her mom, but still, just because you don't have to have done anything, just if they come to you, how do you handle yourself?
Right.
In that situation, because as parents, you're going to talk to your children about how to handle yourself in public or just
Right.
in general. But now it's that added layer of, okay, this is what you do, when there's law enforcement,
Yeah.
so.
And then I'm curious, does this situation or these situations affect how you think you will allow her to interact with certain people as far as her circle of friends or your circle of friends or play dates, play groups? Like, do you feel that will affect the way you choose those people that she can be around?
I don't think so, because I feel like it's more than that,
Yeah.
right? So my parents were very selective and very vocal about who I can hang out with and who I couldn't and why.
Hmm. Hmm.
Um, so, from the, racism standpoint, from the, are they going to be just bad news in general?
Right.
Are they going to be more likely to get in trouble, get arrested and whatnot? Hanging around those types of people, it's, more than just, are they going to get arrested? Are they going to take you away from your goal? Like,
Yeah.
you want your children to be goal oriented. And that's how my parents raised me. I was always like, oh, I got to do my homework first, or or what's my dad going
Hmm.
to say if I get in trouble here? So just
Yeah.
having those kind of things in mind, just from a bigger picture. But when there's that element of the way somebody's thinking, so if there were a friend who, say, didn't carry themselves in a certain way, and if they got into a situation and maybe their parents didn't have the same conversation that I'm going to have with my child, I don't want them to drag her down in that situation. So she may be like, my
Right.
mom told me to stay put, and then they're off doing whatever. You get treated as a group, when those kind of things happen. So yeah,
Right.
if there's somebody who their mind frame isn't right, you're not going to get my daughter in trouble. So that
Yeah.
I will draw the line, at that point,
Yeah.
for sure.
Definitely. Definitely. Well, thanks for your input and your thoughts on that. Everything, from living the life of Corona, having a child in such a difficult time. Um, we're coming to a close here, but, are there any other thoughts, comments, suggestions, recommendations, anything that you would like to say, on this platform?
Honestly, I think in this time, um, mental health is just so important. I mean,
Yeah.
even from something as easy as just finding 5 minutes, to just decompress. I mean, for me, it's going to sound crazy, especially if even 2 months ago, this would have sounded crazy for me to say, but just taking a shower. I mean, that little time of me
I
just
told you.
in, I know,
I
you're
told you.
so right. I come out feeling like $1,000,000. I've had that like 10, 15 minutes to myself. You know, I'm not mom, I'm not wife, I'm just me. And I just had that quiet time to think about whatever I want, you know, or just what I
Yeah,
need to do, or just sit and relax, let the water hit you. And it's just okay, then I can get back to it. But were there days where it's been like crazy and take a shower later? No. Um, you just feel so wound up, and it you just have to release. And I
yeah.
can see it helps how I interact with my husband, with my baby when she's crying and needs different things. Just
Hmm.
you always have to take care of yourself first, you know, before you can kind of take care of others, or just to even navigate these types of situations. So anything, a 5 minute meditation, just anything, you know. I think I just encourage
Yeah,
everybody to find that one thing that they enjoy doing. Um, Even making
yeah.
cookies, I enjoy doing that. So just any little thing, that you
So
enjoy,
true.
just trying to find that at least once a day if you can.
Yeah, so true, so true. And that was
Yeah.
kind of one of the whole reasons why I started Corona Mamas, me just experiencing that isolation going into, lockdown soon after delivery.
Mm-hmm.
Started doing my research, and, almost 20% of women in the postpartum period will experience some sort of mood or anxiety disorder. And the numbers are staggering now in the time of
Oh
Corona.
my God.
And those are the people who are officially diagnosed. You can have symptoms without being diagnosed, being full-fledged.
Mm,
You have those times here and there where you're anxious, you're OCD about something, you're depressed about
yeah.
something, you're feeling down. And so, definitely check us out. If you're watching, look us up on Twitter, Corona Mama One. That's at Corona Mama One. We're linked in with a lot of the postpartum support groups that are on there, the maternal health groups that are on there. And this whole website, the Corona Mamas, is focused on women, young, old, new moms, old moms, pregnant, being able to get through these times, not
Mm-hmm.
only the public health of COVID, but also the public health of racism. So check us out, follow the blog, write to us if you have any, if you want to interview, if you want to write a piece for us to share with anybody, just give us a shout. We'll be happy to share. So thanks so much, Bridget, for talking with us today. I
Yes,
hope we
thank
talk
you.
again soon.
Yes, thank you for having me.